Hi, Dr. Kalea. It's so great to have you as a guest today on the Genetic Genius. Welcome.
Thank you so much for having me.
Yay. I'm so excited today for us to talk all about fertility because you are such a great fertility expert. And I know that the listeners are going to be so stoked to learn all the different aspects. So before we jump in, can you just introduce yourself, talk about what you do right now, and maybe a little, future tip for what's coming in your next week or two, and then what your impact is on the planet right now?
Yeah, absolutely. So I am a naturopathic doctor by training, and then I have additional postdoctorate training at the Institute for Functional Medicine. So I see patients in an integrated clinic setting. I would say my patient population is probably 80, 90% fertility patients at this point, and then maybe 10% kind of general women's primary care. And then when I'm not in the clinic, I'm on the clinical staff at the Institute for Functional Medicine, where we train and certify docs in the functional medicine model. So I think it's a really beautiful blend of worlds, right? I always tell people functional medicine gives me this wonderful roadmap where I can plot out patients because humans are so complex and figure out which body systems need support. And then I can call upon all of the incredible naturopathic therapeutics to help patients reach their goal once we kind of determine what's the path forward. So it's really an excellent situation where I can do, research and curriculum development and then bring that to life in the clinic. So I'm really excited about that work. I love fertility. It's my absolute favorite topic. And then the impact on the planet. This is another, IFM has recently been doing all of this information about planetary health and how that connects to human health. We're really so connected to the earth, and it was really inspiring, got me thinking a lot. And my family's getting ready to make a big move to a sustainable farm where we can kind of contribute to this big process of caring for the earth and in turn caring for humans.
Wow, that's amazing. You have a lot going on.
A lot going on. Yes, just
Yeah. Well, I love the aspect of combining, when thinking about us as humans, us as women, right? And that fertile aspect and then the fertility of the planet. It's like all connected, right?
it's absolutely connected. And it's funny that you mentioned that. I read a quote recently, and I wish I had it up so I could remember, but it basically talked about, the earth goes through cycles of heating and cooling and drying and then being more moist. And that's just like the human body. And especially for women, there's this cyclical nature to it. And so I think that's just a beautiful illustration of how humans aren't really separate from the earth. We're really interconnected with it. And
Hmm.
it's fun to think about.
Totally. And we're definitely going through a change this year.
Absolutely.
Okay, great. So let's dive in and talk about fertility. But first, can you give our listeners just like, what are your expert thoughts on kind of like the change in fertility? Because we've definitely seen, I mean, I don't know what the year span is, but let's just say like the past 10 years, let's narrow it down a little bit. But can you give some insight as to why you think there might be this shift happening right now on the planet?
Yeah, it's really fascinating. As I mentioned, most of my patients are seeking support for fertility, whether they're trying to get pregnant for the first time or they're undergoing, assisted reproduction and they want some support through that process. And I would say that the bulk of my patients are in their late 20s, early 30s. And so we're seeing this rise of a trouble conceiving in women who are young. And we would just think, this should be no problem, but it actually is really challenging. And I've thought a lot about what are the contributing factors that's causing this, what I like to call subfertility rather than infertility, right? Because we know that fertility is really just a snapshot. Anytime we measure it, it's kind of just a snapshot of what's happening. It's a spectrum, and we can push someone on that spectrum at any point. So I've thought a lot about what are the contributing factors to this subfertility, almost epidemic,
Yeah.
right? It's a lot of things: increasing environmental exposures, increasing stress, decreased nutritional value of our foods. Of course, we know that there's been drastic declining, sperm quality, sperm counts over
Hmm.
50 years. I think that it's a multifactorial contribution from a lot of different things. And that this is really why a naturopathic and functional medicine approach to subfertility is so helpful because we look at all of those things, right?
Mm.
Is it because of all of the exposures to different chemicals and medications that are causing gut dysfunction? Our detoxification pathways are so overloaded. Our immune systems are taxed. Our inflammatory cascades are going off of the charts. So I think it's really nice that we take this whole person, whole body approach to kind of start to unpack those factors.
Yeah, that's great. There are so many different variables. And I love what you said about, the approach, because it's not just like looking at like one thing, there's, as naturopathic physicians, we have to look at, more the whole body and the whole environment. And there can be lots of different variables, just like you said, that can be affecting the mental, emotional, energetic field of the female or family.
Yeah, absolutely. And I talk to patients all the time that when we're cultivating this fertile body, it really means we're cultivating whole person wellness, regardless of if your goal is actually pregnancy or not. And I think it speaks to your previous question of, what's contributing to all of these changes. And if we look at the increases in just chronic disease in general and how that relates to fertility outcomes, just thinking about things, like insulin resistance and hypertension and chronic inflammation, all of those things that contribute to chronic disease anyway, those are also really impactful on fertility. So making sure that our whole health is well supported is going to roll over into fertility, whether we're thinking about it or not.
Right. And we'll talk about that too. Like maybe we can dive into that now and talk about preconception. So
Sure.
in the beginning, if you're thinking about having a child, whether it's with your partner or alone or, whatever, there's lots of variables now when we're in 2020. And so when should you start thinking about the aspects of preconception, like how far in advance and what measures are important to start thinking about? When should you start thinking about seeing a naturopathic doctor? When should you think about what you're eating? That type of a thing.
Yeah. Today. Yes.
Today, right? Yesterday, exactly the right answer.
It's patients come and I feel like they want to get pregnant right now and they wanted to get pregnant yesterday. And so then we have to have this conversation about, okay, if we think about how long it takes for a cohort of eggs to mature inside the ovaries, that's about 4 months, right? So minimum, I'd like to start at 4 months. 6 months gives us even better time to set you up for success, to ensure that that next cohort of eggs it's going to mature is going to mature under the absolute optimal circumstances. But in an ideal scenario, if I could control all variables, I would start a year ahead of time, right? Because when we think about, okay, now we want to get pregnant, what do we have to do? There's somewhat of a learning curve in a lot of these pieces. For example, when I'm teaching women how to track their cycle, right? Whether that means doing basal body temperature, using ovulation predictor kits, monitoring their cervical fluid, it can be really overwhelming. And after just one cycle, you don't really get a good understanding of your patterns, right? This is all about pattern recognition. And so giving that several months to get to know your body, get to know your patterns and what affects, things like your sleep quality and your hormone metabolism and the quality of your cervical fluid, that takes time.
Totally. Yeah.
So if we start, well in advance of that, very far in advance, a year is absolutely ideal. And I have some patients that I'm really excited about that are seeing me in their, late teens that come in to talk about, menstrual health and things like that. And I think it's valuable just to start the conversation about how your lifestyle factors when you're in your 20s can roll over to affect your egg quality and your fertility outcomes in your 30s, and start to, get some education going about this is what your menstrual cycle looks like, so that when you're ready to take the next step, it's more natural progression.
Right. Yeah, that's so key. And a lot of that age group that you're just talking about, when you're in your 20s, you're not really thinking necessarily. I mean, some people might be, but it's not the most common thought, like, okay, I can't wait to have a baby tomorrow. It's like more a little bit older. But, in that age, you're thinking more about like, having fun and maybe being at school and just, be more free. So I love that you're thinking about that earlier generation and education, and especially that generation is like, they're the generation of our future. And so when they are priming themselves for the best possible children, it can have a huge impact on the planet.
Yeah, planting those seeds. And it really is about generational health, right? We know that if we can build up the resiliency and the vitality and the nutrition, I always tell people we want to start from a full cup, right? Because you're give and give. So we want to start from a place of abundance. And I think we can start cultivating that abundance immediately, no matter who we are.
Right. Yeah, totally. Yeah. You want to start that conception thought, the light bulb with your cup full. I love that. Yeah, it's great because you don't want to start, being tired or fatigued or, anything that could be on your plate, stress. So I think we'll talk about that for sure. And, we want to be able to, if your cup isn't totally full, being able to manage it. Right. And so that way, when you're thinking about the baby coming forward, it's not like everything's going to be a lot easier once the baby comes.
That all of the time with patients, like we're going to do the blood work and we're going to do my whole, preconception plan, but it extends beyond just the blood work, right? This is building abundance in your relationships with your partner, with your family members, with your support network. It's, we talk about, in some cases, building abundance financially because it can be, financially taxing to have a baby, and just making sure that those resources are in place, building abundance with your nutrients, with your sleep, with your kind of mind body connection. So there's so many ways that you can cultivate a fertile, abundant body.
Yeah. Oh, I love that. Yeah. Abundance is key because focusing on all the abundance around you then allows the baby to be brought into, or one, or twins, or three, whatever's coming in, right? To be brought into an abundant environment. That's so beautiful. I love that. You mentioned a little bit about labs. Maybe we could kind of talk a little bit about that. And so we're in that preconception phase. Are there specific labs that you like to run with women in that phase to kind of make sure that things are primed?
Yeah, so I do preconception labs at 2 different times during the cycle. So I do labs on day 3 and at day 21. So I always, talk to women about, we identify when your menses is going to be day 1, first day of bleeding, and then day 3, we get you into the lab to do some lab work. And so that means I'm looking at, I do a full thyroid panel. So lots of my patients come to me with just a TSH, right? And then we have this conversation about, well, TSH is the signal, obviously, that goes from your brain to your thyroid gland to tell your thyroid to make thyroid hormone, but that's only half of the story. I really
right.
to make sure that your thyroid is actually listening to that message.
Yeah, hello.
So we also measure free thyroid hormone as well as thyroid antibodies. We know that, even if TSH looks textbook perfect on paper, when there's the presence of particularly thyroid peroxidase antibodies, that can cause this inflammatory response that is associated with things like subfertility, pregnancy loss, gestational hypertension. So I just want to know about that.
Right.
Beginning. So we have some great naturopathic tools to lower thyroid antibodies. So let's understand what's happening. I also like to look at, markers of iron sufficiency. So that means for me, a CBC, but also a ferritin being this really important storage form of iron. When we look at the medical literature, we see that ferritin is actually really important in terms of egg growth and maturation. And it's also super important to help build up that inner layer of the uterine lining, the endometrium. And so ferritin below 40 can be associated with subfertility. So I like to get it up there. If it's low, we can do that through, a variety of mechanisms. Ferritin, we look at thyroid. I like to look at inflammatory status. So my favorite marker is high sensitivity C-reactive protein. We know that endometrium is really responsive to chronic inflammation, and we want to encourage endometrial receptivity, right? The ability of that endometrium to accept an embryo should an egg fertilize. So I always want to get inflammation under control. I look at hormones, so follicle stimulating hormone, luteinizing hormone, estradiol, which is our main circulating form of estrogen, testosterone, DHEA sulfate. I look at prolactin, anti-Müllerian hormone. So we do a pretty, thorough lab evaluation of hormones. And then of course we look at, a comprehensive metabolic panel. We look at glucose, hemoglobin A1C, and also insulin, fasting insulin, which is so important in terms of, hormone balance and also inflammation. Those all have a very intricate relationship. So we do a pretty comprehensive preconception panel. And I always tell patients, you're going to be fasting, go to the lab on cycle day 3, and you make a morning appointment and bring a snack because we're going to take quite a bit of blood. And our local phlebotomist always says, oh, I know that you've come from a naturopathic doctor. all of the testing, which I'm honored by because we're,
Mhm.
doing this test, don't guess situation. So that's day 3. And then on day 21-ish, or about a week after anticipated ovulation, I send patients back to the lab to do a serum progesterone just to make sure they're ovulating. So we get a lot of data in the preconception phase.
Yeah, that's great. It's so thorough. And I love that. And you have to be when, especially I think now with, like, as we talked about earlier, all of the different aspects of subfertility, as you mentioned, we want to make sure that the body is primed for preconception or conception. But, and also, like you said too, that when going through the pregnancy and into delivery, there's a lot of different aspects that we want to make sure are in line for the best possible outcome, the healthiest mother and baby.
Absolutely. And so I'll just add just really briefly, and
Mhm.
you can know how much detail you want to go into, but we that's kind of our standard lab process. And then we always do have the option to do functional laboratory analysis as well. So things like comprehensive stool analysis, micronutrient analysis, which is so great in terms of making sure that your, nutrient stores are adequate.
Totally. Hmm.
Very cortisol testing, oxidative stress testing. There's all kinds of kind of add-ons that we can do on a case by case basis so that we can really understand what's going on.
Yeah, exactly. And let's, since we're talking about that, and you mentioned cortisol, let's talk about the stress factor since it's really a big thing on the plate this year. And so, have you seen one, maybe like a shift in more people coming to you for subfertility issues because stress has been higher, or on the other side of the coin, are we seeing an increase in actual conception and pregnancy because people are having, a change in their lifestyle?
I think it's both.
Totally.
So the first part with the cortisol, it's interesting because we know that, elevated cortisol and kind of adrenal dysfunction can affect fertility in a couple different ways. So the first way I think about is that cortisol can be somewhat inhibitory on our gonadotropin. So follicle stimulating hormone, luteinizing hormone, these are the signals that come from the brain to tell the ovaries mature a cohort of eggs and then release that golden egg that has been selected as the winner during ovulation, right? So if pregnancy is the goal, we do not want inhibition of those hormones in the early phase of our menstrual cycle. We want our ovaries to develop this cohort of eggs. So that's one thing I'm thinking about. The other another piece that I think about is, cortisol and melatonin are somewhat counterparts. And melatonin is such a powerful antioxidant that can concentrate in the follicular fluid, which is basically the soup that our egg cells are swimming in inside our ovaries. And so we want melatonin to be really robust in that follicular fluid to protect our eggs from cellular damage. And so when cortisol is, taking over in the nighttime hours, when melatonin would normally be rising, then we have less protection from oxidative stress in our ovaries. And we want to make sure that our ovaries are super healthy. And then the last part of it is when people are stressed out, they just are less likely to feel connected to their partner. They're less likely to want to be intimate. They're just like stressed out. They're not in the mood.
Mm-hmm.
And so just in terms of, partner compatibility and intimacy, it can be really taxing.
Yeah, totally. Has so many different aspects. And as you were talking about before with the financial, aspect of abundance, when there's so many different stress factors that might be new to a couple, or, I keep saying the word couple, but you don't have to be a couple to have a child or to have a baby, anything like that. But, I think that people are seeing the aspects of stress in a different way. And so do you work with your subfertility or fertility patients with managing stress in that aspect?
Yeah, absolutely. So we actually do quite a bit of 4-point salivary cortisol testing in our clinic, looking at, both cortisol, but also DHEA sulfate, which is produced by the adrenal glands, really powerful antioxidant to protect egg quality. So we want to make sure the adrenals are healthy for a lot of different reasons. So we do a lot of salivary cortisol testing. We use a lot of adaptogenic botanicals, make stress responses on point. We also, in our clinic, we're very fortunate to have acupuncture, chiropractic, physical therapy, massage therapy. So lots of tools to get some physical medicine on board, which is so helpful for our stress response as well. And then we also work with a counseling referral service. So I'm very often meeting, putting in a referral to that service, letting them know what my patient's insurance provider is and what their particular needs are. And I'm matching them with a licensed mental health professional so that we can all work together to make sure they're really well supported.
Oh, it's so great. And I think what you mentioned right there is so key to having that network. It's the support of the family, and also your medical team is your support team. So, if and seeing a naturopathic physician in the beginning really helps to establish what those needs are for that support of the preconception phase, and then continuing through, and forever. It could be a long time of help.
Actually thought that was one of the really a strength of naturopathic doctors is that I think we're less likely to have this mentality that we need to hold all of the pieces. I think we're really good networkers and really good at assembling a collaborative care team that ultimately really benefits the patient.
Right. Yeah. Because we can't do it all. And we don't want to, because we got so much other stuff we need to help with. Right. Okay. So we talked about, I'd like to go back and talk, you mentioned nutrition. So if we can talk about, so you mentioned one thing was like optimal nutrition. And then you also mentioned like nutritional lab work. So if we can talk about you mentioned iron, but some of the other nutrients, whether that's from taking a supplement itself or from food. I'd love to talk about food too. Don't want to say, let's be focused, but yeah, if you can talk about some of the nutrients that are key for preconception and then also through pregnancy.
Yeah, absolutely. So when my patients come in, I give almost everyone one of two food plans. So just to set some background information, the Institute for Functional Medicine has developed all of these excellent evidence-based food plans that I use, every day. So the first one I use often is called the cardiometabolic food plan. And this is a derivative of the Mediterranean diet. If we look to the research, the Mediterranean diet is probably the most well-researched in terms of supporting both natural conception rates, but also when patients are going through, assisted reproduction, IUI, IVF. And so I'm a huge fan of the Mediterranean diet. And it makes sense that this is really fertility supportive, right? It's low glycemic, it's anti-inflammatory, it's packed full of B vitamins and omega-3s, which are so important in terms of optimal fertility. So I'm recommending the cardiometabolic food plan very often in my fertility patients that maybe also need some support with things like insulin resistance. If they have even elevated blood sugar, a little bit elevated blood pressure, any kind of cardiometabolic issues, that's my go-to. For my fertility patients that maybe are dealing with PCOS or are not ovulating regularly, I'm often calling in a food plan called the Mito food plan. And we can talk all about how important Mito are.
Yes.
My favorite little organelles, they're the produces of our cell, and they really produce cellular energy that drives these, what I call energetically expensive processes like ovulation, fertilization, implantation. So I love to give the Mito food plan, which is really designed to support those little energy powerhouses with some specific therapeutic foods. Again, it's phytonutrient rich, it's low glycemic, it's anti-inflammatory. I love that it really focuses on eating a phytonutrient spectrum, so a rainbow of colors. We know how important antioxidant protection is for our egg health, and the best way to ensure broad antioxidant protection is just to eat a rainbow of fruits and vegetables every day, right? So the Mito food plan really encompasses those pillars of optimal fertility. So I'm always starting with those food plans, either one kind of depending on what the patient's needs are. And then we can do targeted supplementation, right? Iron, B vitamins. I do sometimes test B vitamins in the blood, and then we're doing, oral B vitamins or B vitamin injections, something we do all of the time. And then a really great, just a good quality prenatal vitamin. So I have a prenatal that I love that includes more choline than normal. We know choline is so important for baby brain development, in preconception and then throughout pregnancy. So those are kind of the things that I focus on. And then I do micronutrient analysis in some cases if patients are interested in that. So then we can get a really targeted approach. And then if things come back and there's lots of deficiencies and patients are like, well, I'm eating really healthy, I don't get it. Then we can dive deeper into, okay, well, what's going on with the gut, which is your, absorptive surfaces,
Right.
what's going on with your gut health and your stomach acid production. And it opens the door for us to do some deeper digging. So nutrition, I did my undergraduate degree in nutrition. So I definitely feel like I'm a food first type gal. So we always start there, but supplements are always an option too.
Yeah. Oh, that's great. Yeah. I loved how you explained those two different types of food plants, which are so important and so key because the nutrients are supporting every aspect of the environment of the health of the egg and the health of the mother. And I especially love mitochondria. Who doesn't need those? Especially now, I feel like everybody's like, the more energy you can get, the better.
Yeah. What people always say is like, yes, it improves fertility, but also I have more energy and I sleep better and my brain fog improves, and it rolls over into so many other aspects of life.
Yeah, totally. I love that. Okay, great. So it sounds like there's some wonderful nutritional plans that can be put into place, as well as some possible nutrient testing to really dive deep and see how can the best optimal environment be created.
Yeah, yeah. And the last thing I'll say about that is we do have a certified nutritionist in our office, and I
Mhm.
refer to her often, right? Because it's one thing for me to say, here's these food plans and they're so awesome, but the practical implementation of how do you fit this into your real life is like, again, another opportunity for us to collaborate.
Yeah, totally. And it can be overwhelming, especially when, like you were saying before, there's all these different pieces about measuring ovulation and how's your health. And yeah, so it's great to have that nutritionist on board who can then help implement the new lifestyle changes. Because preconception can be a lifestyle change, but there's a lot more other lifestyle change coming forward, and having those pieces in place and now in the beginning is so key. Like you said, like a year in advance. What a great plan.
Exactly.
Mm-hmm. Great. Okay. So can we talk a little bit about IVF? So do you work with a lot of patients who are, have been trying to have conceive for a long period of time, have gone through IVF? Are there ways that working with you can then help someone that's working with IVF to have better success?
Yeah, absolutely. This is an area where I really like to talk about because I think I'm always trying to build bridges between, our naturopathic functional medicine community and then the specialists who are doing, these higher intervention procedures that we don't offer, but that there's so many ways that we can collaborate. So
Mm-hmm.
I'll give you some examples. When I was in my final year of naturopathic medical school, I was rotating through all of the largest fertility clinics here in the Seattle area and spending time, in the operating room doing watching them do all of the procedures and in their new patient intakes. And I was seeing so many, what I was identifying as really lifestyle related conditions, right? Type 2 diabetes, super low vitamin D, insulin resistance, all of these areas where I thought our medicine is the perfect tool to support this
Mm-hmm.
patient. And I never promise you might still need IVF, right? But we
Right.
have these tools that can support and make those outcomes more successful. And so I love to work with patients when they're going through IUI or IVF, and we do all of our same preconception labs. I sometimes find patients are maybe on their third or fourth round of IUI, and maybe they haven't had something like fasting insulin measured, or their inflammatory markers, and or their thyroid antibodies. And so we uncover these things, and then their next cycle is successful. And so
Mm-hmm.
I think it's really important that we still go through all of the steps, just like it was any preconception visit, no matter what kind of strategy the patient is using to conceive. And then, example with my patients that are doing IUI, I like to recommend some things that they do after the procedure. So, even things like you can focus on eating foods that increase nitric oxide to help support that blood flow to the endometrium. So, beets and leafy greens and dark chocolate and all of these things that we know can really support pelvic blood flow. Focusing on healthy fats so that we can maintain the viscosity of the blood, promote all of that nice blood flow through the pelvis. And then we can work on, the stress response and connecting with your partner and all of these lifestyle things that are important no matter what.
Mm-hmm.
So I think that we absolutely 100% have tools that can support those assisted reproduction methods. And even if patients still need those services, maybe we can, help it so that their IUI is successful and they don't need to go on to IVF.
Right. Yeah. So key. Like I love what you said, like that collaboration, because when we have that support for the patient, it allows them to feel so much like a sense of relief. Right.
Mhm.
And that's so key. And, there are so many different tools that we can do to help support the woman, the female, the mother as she's going into that phase. So that's so key. I love that.
Yeah, and we're really lucky, I will say, here in the Seattle area. I'm not sure how it is everywhere, but I think our community has a really good relationship with the reproductive endocrinologists. Like, I refer to them, and I think everybody understands everybody's value, right? And so I think that is also so special about our area, that we can collaborate pretty seamlessly, and the patient really benefits from that.
Yeah, that's true. And hopefully we're moving into a space of that worldwide. Would be great. Yes.
Absolutely.
Okay, wonderful. And so when you, just as a sidetrack back to the IVF and nutrition combined together, so you mentioned a couple nutrients. Is food planning an aspect of the nutritional component of IVF? Does that make sense, my question? So when you're working, you talked about the mito food plan and the cardiometabolic food plan. And
Yeah.
are those, if someone is coming and they're doing the IVF and they're wanting to have the best environment for the IVF, can you, that's what my main question is. Can you speak to that? How can they work on having that best environment?
Yeah. So in either case, I'm likely calling in, again, cardiometabolic food plan or mito food plan. Those are my go-tos for fertility. Again, tailoring it to, is there, more of an inflammatory response in this patient, where I might choose cardiometabolic food plan, or is there more, was this patient having anovulatory cycles? Is there some indication that there's mitochondrial dysfunction? And then I'm calling in mito food plan. But then we think about all of the things that affect endometrial receptivity, right? Because it's so mind-blowing to me that endometrium, it doesn't just accept an embryo any old time of day, right?
So prime environment, right?
Prime, not, it depends on hormonal factors, estrogen and progesterone. It depends on inflammatory status. There's some research to show that vitamin D plays a role in endometrial receptivity. Certainly there's some genetic factors as well. But when we think about all of the different aspects of fertility, so when I'm seeing a preconception patient, I think about, okay, we have to think about ovulation and, egg quality, sperm quality. We have to think about the health of the endometrium. And when we're, doing IVF, for example, it kind of took out the variable of the egg piece and the sperm piece. They're going to do that work. We know that we have an embryo that has perhaps had pre-implantation genetic screening. So we know that it's, a chromosomally normal embryo. And then really the part that then we want to think about is the endometrial receptivity part. So making sure all of those foundations are there, that there's good blood flow, that iron is sufficient, that vitamin D is sufficient, which almost no one has their vitamin D measured. So that's
so weird, right?
That inflammation is controlled and that progesterone is adequate. We have so many tools that we can help to support that endometrium.
Yeah. Oh, that's great. Perfect. And let's talk about sperm. So we've talked a lot about the egg and the female component. So do you work with, the male component at all? Do the couples come in together, and what's the talk that you have? Is there testing, all of that?
This is hilarious because I will admit my only male patients in my practice are the husbands of my other preconception patients that and I don't have any males in my practice that aren't fertility related. But this is the perfect opportunity to support sperm health. And what I will say is that sperm are basically just like swimming little mitochondrial guys. So all of my male fertility patients are going on the mito food plan. We really got to power that. Really, the ATP, that cellular energy that's produced by our mitochondria, is driving forward the sperm's ability to swim in a semi-straight line and to undergo its reaction where it actually penetrates an egg. And so the mitochondrial health is going to be absolutely vitally, crucially important. We also think about things like antioxidants to protect that sperm quality. Guys are unique in that they're producing these sperm rapidly all of the time. And so really I have found that sperm health responds more quickly to lifestyle and dietary interventions than anything. I mean, we can see it within, 1 month, we can see a huge improvement in sperm quality when we really focus on diet, lifestyle. One thing I've been thinking about a lot as we're in the work from home era is everyone, at their desk job. And we know that guys that spend more than 50% of their time seated in a sedentary position have pretty rapid declining sperm quality. And so I'm always telling my male patients, get up every hour or so just to let that testicular area kind of cool off, right? Because heat damage to sperm is so problematic. So get up, let your blood flow a little bit. And then we know that sleep, in addition, is so vitally important. When, they did all of these terrible studies where they have these poor college student guys volunteer for these studies, and they sleep deprived them, right? And they found that when they were sleeping less than 5 hours per night, their sperm quality was way worse.
Yeah, makes sense. Totally makes sense.
Foundational pieces are there for our sperm producers as well.
Yeah. Oh, great. That's so key, and we don't want to leave out the other partners that are important, and with our LGBTQ couples too, it's not just, we can have two men that are trying to have a young baby come into their life, or we can have two women. So one question about to a female couple, do you do testing that would then show who would be, the prime receiver, so to speak? So let's say if two women come in and they're like, we're ready to have a baby, we're a couple, blah, blah, blah. And so do you do the same testing on both of them?
I actually have had this come up a couple times. And what it's turned out to be is we do our full preconception lab, right? And I'll give you one example that we had a female couple and they were both being evaluated to see, who's going to carry this pregnancy, with the hopes that they actually both could at some point. But who was going to carry the first baby? So we did, all of the testing, and we found that one of the women had a lower anti-Müllerian hormone, which is a marker of ovarian reserve, right? It's not a perfect test, but it's a conversation starter to say like, oh, well, the longevity of your fertility might be a little bit shorter, right? And so while both of their labs looked pretty good, her AMH was a little bit lower. So they decided that they were actually going to proceed with her carrying the first baby. And it worked. It was a successful pregnancy. They had a baby girl, and then actually went on. And then the other partner had a successful pregnancy.
Yay.
And so lots of factors. Oftentimes when I see married couples that are two women, that sometimes there's, one person that wants to be pregnant and the other one is not as interested. So then we, really focus on building up that fertile body in the partner that's ready for a pregnancy. So there's lots of different factors, but we can certainly do some testing and let that guide us.
Right. Oh, that's great. I love that story. Thanks for sharing. It's true. It's like, how valuable labs can be for showing the prime, so to speak, the body that's ready. And when you are two women as a couple and thinking about having children, you do need to make the decisions about who's the more fertile of the two, because you don't want to wait too long if you're in that age range.
Yeah, exactly. And just while we're talking about it, just because it's the sweetest story, when I was a student and I was rotating through the fertility clinics, I was with a couple that was two women, and they actually ended up doing some IVF and fertilized an egg from one partner that then the other partner carried the pregnancy. And I thought that was just the most way, so that they both contributed in their own way. And it really just underscores the fact that you can build a family in so many diverse ways, and it works.
Yeah. Oh, that's so true. Yeah. And we're having, with the way where we are now in 2020, we're all different ways and different aspects that we can conceive. And who knows what the future is going to look like for that too.
Exactly. It's exciting. And It's changing.
I know, totally. One of the things you mentioned earlier was about genetic testing. Can you mention some aspects that are key for testing for preconception and that the couples need to know about, or the parent needs to know about moving into preconception and then to pregnancy?
Yeah. So I would say that this is where it always requires a lot of informed consent, right? Because when we start doing genetic testing, my concern is always, for example, let's say we do some, MTHFR, right? That's so prevalent in our mind. So let's say we do some testing and we find that someone has an MTHFR polymorphism, and then, we know that that specific polymorphism can be associated with early pregnancy loss. And sometimes, even though we have, mechanisms to kind of overcome that pathway, patients really internalize that information, that that's their destiny, that they are doomed.
Right.
It has to be a very, caring and empathetic conversation of, we can get this information, but it doesn't mean that this is your destiny.
Right. It's not written in stone or in blood forever. Right.
Gives us some information so that we might alter our treatment a little differently, right? But it doesn't ensure, it's not a guarantee that something bad is going to happen. And so sometimes we always have to have the conversation of, do we want to just kind of go for it? And then if you have trouble or there's some pregnancy loss issues, then we dive deeper, or do we want all of the information right, at the very beginning so that you can decide? So that's always something that we talk about with patients. And then we have the opportunity. Functional lab testing is so advanced and amazing now that we have the opportunity to look at MTHFR, to look at COMT, these methylation oriented polymorphisms, to even look at things like ApoE, which tell us about our Alzheimer's risk, but to some extent can tell us how we're, managing our lipids, which is also important in terms of fertility. So we certainly have the option to do some genetic testing, and it's always a very thoughtful and thorough discussion and decision-making process.
Yeah, I that's so key. And I love the conversation that we can have with patients about, especially patient mothers and fathers to be, that it's not, like you said, it's not written in stone. It's not the end all. It's information that we can use for prevention. Right. And so it's not a scary place. Like you said, you don't want that to be the fear factor when you find, like, oh my gosh, I have the polymorphism of this gene. That's not what it's about. It's about empowering. And that's what naturopathic medicine is in general, right? It's about empowering our patients, empowering them to take charge of their own health. And that's what I think that, that key piece you're talking about with the genetics can really help them. Like, oh yeah, this might be contributing to my infertility. Let's work on it and see what happens.
Yeah, absolutely. And there are some new panels coming out. I've been talking to some companies that do some DNA testing, and with, fertility focused panels looking at
great.
most focused on fertility and pregnancy outcomes. There's a lot of research about polymorphisms and their relationship to things like preeclampsia, gestational hypertension, gestational diabetes. And so there's some new panels that are coming out that can give us some indication of someone's predisposition to these things. And so we can say, okay, we see that, we did your fasting insulin, and maybe it's a little bit elevated where normally we wouldn't be worried, but we see that your genetic makeup actually puts you at higher risk for something like preeclampsia. Let's actually be a little bit more strict with, our inflammation, our insulin, our fluid balance.
Right. Great. Yeah, totally. Yeah. Love that. Just looking at that genetic information and seeing how we can have the best outcome, be the most preventive. And that's what the future of our medicine is anyway, right? Is preventative wellness, so that we can take charge and have the information to have the best health for every aspect, especially our children coming to the world.
Yeah. Nothing more, preventive than preconception health, right?
Right.
Doing, prevention at the very foundational level of creating a new human.
Right. Yeah. It's a lot of work. Or it cannot be a lot of work, depending on what happens. But we're seeing that people are having to work a little bit harder, which is why we're having this conversation.
Yeah. And even if it's still has to give so much. And I always joke, I say this sometimes, that I tell my 6-year-old when she's being a little sassy, I built your skeleton with the calcium from my own bones. So let's just get it
So no more sass. Oh, that's funny. I love that. Yeah. So one thing I wanted to talk to you about too is, okay, so we have the picture of preconception, and working with the sub fertility, that optimization. So what does it look like in that transition? Do you still work with patients as they're moving into pregnancy? Because that's like a key aspect of it too. And what's that optimal time period look like for them over that 9 months? And do you have that same kind of like plan as they're moving forward based on the individual?
Yeah. So once our patients get pregnant, which is always like
Yay!
an amazing portal message that we get, I continue to work with them because people tend to have a lot of questions about, okay, now I got the positive pregnancy test, but what?
Now what?
It's about, okay, how do we continue on to our nutritional plan? And then also just helping them connect with the right birth provider. So this is a conversation that I love to have, of thinking about what our values are in terms of, do we want to have a hospital birth with an OB? Do we want to have a hospital birth with a midwife? Do we want to have, a birth center or a home birth? What values do you have for your birth? What's most important to you? And then we can connect our patients to some of the resources in our community to help them, with whatever provider that they choose. And so I think sometimes people don't even, you get pregnant, but you haven't really thought about what kind of birth you want and who you want to be there and what kind of resources and support system that you might want to think about. And do you want to breastfeed, and do you need a lactation consultant? So there's all of these questions that can come up in very early pregnancy. So we try to anchor all of those and connect to the right resources. And then of course we continue to, I see my pregnant patients, if they do need some support with stress and nutrition or things like nausea throughout their pregnancy. But we always try to connect them with, a healthcare provider that we can work with that will also help manage some of those things. And then I always tell them, I'm so excited when you come back to me postpartum so that we can start building you up again. So about 6 weeks postpartum, I see patients again, and we really start to support them, in that time where it's common to have postnatal depletion, and trying to mitigate some of that. And also just making sure mama has some time to herself, even if it's to go to the doctor.
That's right. Yeah. Sometimes that can be the only relief, right? Yeah. I love that you said that. Oh, sorry. Go ahead.
Oh, just some alone time for a minute when it's just mom the focus, and we want to make sure that her wellness is on point.
Yeah, totally. And you mentioned such a key piece of the whole puzzle, right? Is that postnatal care. Cause I think that there is so much now we're putting into the preconception phase, the suboptimal fertility, all that. And then it's like, as soon as the baby comes, it's like, okay, but wait, this is one of the most key times that prenatal care is so key, or postnatal, I'm sorry, postnatal care is so key, because a lot of women need like way more support during that time because of all different things that could have happened during the birth that they had no idea that were going to happen, which is very common.
Very, and I have 2 small children, and when you're in that postpartum weirdness, I think you don't actually realize that you need some support until someone maybe tells you like, wow, I want to take care of you. And I remember, when my first daughter was born, it was actually her pediatrician that was like, oh, well, how are you? And I was like, whoa, someone is, I am. And it was just, like life-changing, even though it seems like such a simple question. So just making sure that someone is asking that is vitally important. And then there's this great book called The Postnatal Depletion Cure that I always recommend to patients. And it talks about, the most common postpartum nutrient deficiencies, how to recognize their signs, how to boost those levels. And so this is something that we're always talking about. Your body just went through a massive change. Not only did you grow a new person from scratch, but there's also an amount of healing involved, right? Because then you had to support that person's exit from your body, which no matter how that happens is going to be a bit traumatic. And there's going to be some tissue healing that will be required. And so there's so many, energetically expensive, again, things that are happening in the body. So how do we make sure that that's all well supported and has the tools that we need?
Oh, that's great. Yeah. I that's so key to have all those pieces. of the care from the beginning and through the care after the baby's born, and so key. And I think especially now when we're, I've had friends and family members, neighbors that have either had their babies or are now pregnant, and it's a whole different, thought process. Like one of our neighbors couldn't even, the father couldn't be in the room where it was at the very beginning of COVID, and he had to sleep in his car, like while the birth was happening. I was just felt so sad for the family, and so when I think about it, was not just, someone I know, but probably all over the planet. So, I think that postnatal care will be continuing in a different way moving forward, because, that's pretty traumatic to not have your partner that you love, the father or the mother, be able to be in the room.
Yeah, we're seeing that a lot with, ultrasounds happening on FaceTime, people missing, even those early pediatric appointments. And it is really challenging, and it does require a new level of mental, emotional, spiritual support. It's very interesting to see the shift, I have patients that they get pregnant and they're doing their prenatal visits, and, it has to be a telemedicine situation. So for example, I have some people where, a Doppler has been sent to their house. So they put it up and they listen to baby's heartbeat on the line with the Doppler. And so it's really strange, but I will say it's also a bit, just to kind of shift it in a positive direction, it's kind of empowering in a lot of ways, because we're kind of forced to take charge of some things. And the example I'll give is, I have some pregnant patients who they have to do their own blood pressure at home, right, during their prenatal visits. And this is actually kind of nice to have that skill to be able to monitor for yourself, where, if that wasn't the case, you would go to the visit, the person would take your blood pressure for you, and then you would just be on with your day. And so it's kind of nice that we are getting empowered with some additional skills, for better or for worse.
Yeah, I agree. Looking at everything in the positive light moving forward is just a really great place for us to be.
As hard as it is sometimes.
Yeah, right. I know, totally. Okay. The last question that I have for you today is, if you had this like unlimited budget, what would you do with the money to make the most impact, especially right now, make the most impact for, it could be around fertility or whatever on the planet?
Yeah, well, I'll focus mine, I think, on fertility, because that's where I think about the most in my whole world. And I always think about, that education is power, knowledge is power. And there are so many women that I have come into my practice, and they're in their 30s, and no one has ever talked to them about, how do you track your menstrual cycle? How do you know when you're ovulating? Right. And it's like, people feel like they have been cheated from this information that they deserve to have, that's theirs to own, but just no one was there to deliver it. And so I have brainstormed so many times. I wish I could just make these programs that were based on, specific conditions. So, a PCOS program or endometriosis program, or just learning about your cycle program, these really comprehensive programs that involved education, that involved lab work, that involved a doctor visit, and just give them out into the whole world so that everyone could have this information that they have a right to.
Right.
If I had all the money in the world and I could just develop all of this and give it out to patients, I think that knowledge is an invaluable gift. And so to put that out into the world would be a dream.
Oh yeah. Oh, so good. Yeah, you're right. Like we do when I remember when I was in sex ed classes, I didn't get any of that type of information. Nothing. I learned it along the way through my own education, but I'm sure that I hope that some of the sex ed education classes have changed now, but who knows, but I love that you're talking about, educating from the very beginning, when women first start having their cycle. What's the cycle about? What's ovulation? How can you track it? Because it's not just about conception and fertility. It's how we feel empowered as women to know how our body works.
Yeah, exactly. And especially if we think about, we have more energy at different times of our cycle, and we need to be more gentle with ourselves. And even, when I tell patients about cervical fluid, which we could do a whole episode just about cervical fluid, and it's like, why has no one said anything about this for the first 35 years of my life, right?
Yeah, it's so crazy. Well, that can be your next, your little ebook or your next episode for sure. Okay. Thank you, Dr. Kalea. It's been such a joy to have you on this show today. And I learned a ton, and I'm sure our listeners are going to be so excited to learn about taking their next step with fertility.
Thank you so much for having me. It was a pleasure.